if you had one thing that you could just say, boom, this is...
That would be the high impact. It would be the partnerships, clearly. Okay. I really think that is the way to go. And it's also an opportunity for hospitals to partner as well. Because it's, for years in my time anyway, it was taboo to call the hospital down the street to say, hey, let's do something together. And years ago, I remember I had a hospital, a children's hospital, when I was a chief nurse in Maryland, and right across, which was about 20 minutes away, there was a children's hospital that was, I was their training ground. Like, I'll train all the nurses, and then as soon as that hospital has an opening, they'll go over there. And it's not because of anything I wasn't doing.
Right.
Because, now, of course, there's always a lot more to be desired, but I knew that they offered something that I couldn't. I had a little pediatric unit. This is a major mecca of pediatric care. So, of course, nurses will want to go there because they want to be able to expand on their skills. So, out of desperation, I called the chief nursing officer over there, and I said, we need a partner. And I didn't even know what to say. I didn't expect her to answer the phone, but I just said, we need a partner. And she said, I'm intrigued, and that was my opening.
Wow.
So I took the time between then and when we met, we were scheduled to meet, to really start plotting out what I was going to say. And I didn't ask permission, which I should have, but I was going to proceed until apprehended. And I called her. So we had our call, and I said, yeah, I would like for you to brand my pediatric unit, employ my nurses, and I'll just provide you the supplies and the support resources. Just, I want to set this up as under new management with your branding on it. Right. And it was a trusted brand in our community. And we will always transfer our pediatric patients there whenever we can figure out what was wrong. But that created unnecessary havoc in the lives of these parents because, you know how it feels, and a lot of them didn't have transportation, you know. So, so we did. She was open to it. We put together a proposal. We both shared it with our executive leaders. They were a bit annoyed at us because they felt that this doesn't usually start with nurses. It's usually is initiated by the COO or the CEO. But they gave us, side eyes, and they said, keep moving and keep us posted. And we did it. We launched.
That's awesome.
We reopened the unit. We had a community event where people came and did a ribbon cutting. We were able to reduce transfers out of the emergency room. We were able to provide care. It reduced my turnover significantly, kept my nurses whole. Those are the types of relationships and partnerships we need to form.
Right. That's amazing. Okay. So just to kind of wrap this up, if there's something that you would like to advise healthcare organizations that are watching this to do, because we've talked about a lot of things. I know you said partnerships is probably the main thing. What is that first step they could take? Like, what's that first meeting, that first phone call? What should that look like to start in that direction?
I think, and there are hospitals that are doing this already, but it's really about disruption, like intentional disruption. And even setting up a meeting with a lot of stakeholders within and outside the institution, community leaders and stuff, and just say, what should we do that we've not done yet to address this issue? Like, just ask that question. That will open up this brainstorming, work on prioritizing what could have high impact, and maybe your low-hanging fruit, your high-impact, low-difficulty type of items. Get those done, measure it, and just keep moving. And make it everybody's business, right? It's not just for certain people in certain departments, it's everyone's. Like, every nurse working in every institution should care about, where am I discharging you to?
Right.
What home are you going to? Does it have electricity? Does it have, where do you get your food? Right? And the thing is, I know it's hard because there's, as I mentioned in my talk, nurses have to do so much in a short period of time. Yeah. But that's where leadership comes in. We need to free nurses up so they can have these conversations. That's what nursing was for years. And we need to get back to that. It's really about that holistic care, that whole person piece.